Hello everyone, this is Inad Al-Qureshi. Today I'm doing a review on BERTHop, an effective vision and language model for chest X-ray disease diagnosis. This paper has six authors. The first author are the ones from the University of California. The second author are the ones from the University of South California. Okay, so the problem of chest X-ray disease diagnosis can be summarized into 2 points or two main things, which is the first one is interpreting chest X-ray accurately can be challenging even for experienced radiologists. The second problem statement is that computer-aided diagnosis system that use machine learning algorithm can assist radiologists in making more accurate and efficient diagnosis. These problems need to be solved because chest X-ray can help diagnose and monitor various heart and lung disease that can have serious consequences. Also, chest X-ray can help diagnose and monitor various heart and lung disease that can have serious consequences. Some challenges hold back from solving these problems discussed previously, such as chest X-ray may miss early or small abnormalities, causing delayed or misdiagnosis. Also, chest X-rays can differentiate between various lung diseases, like pneumonia or lung cancer. Lastly, trained radiologists are required to interpret chest X-rays, which can be a limitation in areas where few medical professionals. Before we move on, we need to understand two concepts. The first one is X-rays and chest X-rays. The X-ray are a type of electromagnetic radiation used in medical imaging to create detailed image of the body. They can pass through many materials, including the body, but high level of exposure can be harmful. Secondly is chest X-rays, where use low radiation to create images of the chest for detecting lungs, heart, and other chest-related conditions. Another concept needed to be understood is the vision and language model, which is a type of artificial intelligence model that combines both visual and textual information to perform various tasks such as image captioning, visual question answering, and image text retrieval. These models are typically based on deep neural network and use techniques such as convolutional neural network for image processing and transformer models and for language processing. By integrating both visual and textual information, vision and language models can learn to understand the relationships between the two modalities and generate more comprehensive and accurate results. There are two main related topics combined in this paper. As we discussed, is the first one is the vision and language models and chest X-ray disease diagnosis. There are many related studies to this paper, but we will limit to 4 studies in this presentation. So first study is estimating lung cancer risk from chest X-ray and symptoms, a prospective cohort study. The study aims to establish the sensitivity and specificity of CXR for lung cancer and determine the positive predictive values of each presenting symptoms for lung cancer following a negative CXR. One limitation of the study is that it relied on self-reported symptoms and may have missed some cases. Second study is the diagnostic value of chest X-ray in patients with suspected infection and no respiratory signs or symptoms. This aim to determine whether a CXR has any diagnostic value in patients with a suspected infection without localizing signs or symptoms. The study excluded patients who were unable to provide a reliable medical history, which is considered a weakness. The third study is early stage lung cancer is associated with higher frequency of chest X-ray up to 3 years before diagnosis. The one drawback of this study is did not count for the patient potential confounding factor. The last study is COVID-19 diagnosis, chest X-ray and CT scan. And one drawback of this study is that it did not provide a systematic review or meta-analysis of the available evidence. The proposed approach in the study differs from previous studies in two main aspects. The first one is visual feature encoder. And instead of using an object detector pre-trained on a general domain dataset, which may not be suitable for medical images, the proposed approach leverages BERTHop and unsupervised data efficient method to extract visual feature from CXR images. BERTHop is based on successive subspace learning and can capture both local and global information from images without requiring any annotation. The second aspect is vision and language model, and instead of using symbol model or attention mechanism to combine image and text feature, which may not capture the complex association between them, the proposed approach uses visual BERT, a transformer based model pre-trained on a large-scale vision and language dataset. Motivation and impact. So the motivation behind the proposed approach is to improve the accuracy and efficiency of chest X-ray disease diagnosis by leveraging both image and text input. Chest X-ray disease diagnosis is a challenging task that involves identifying disease from CXR images and clinical reports. However, most existing studies focus on either image-only or text-only diagnosis, or use simple method to combine image and text feature. These methods may not capture the complex association between the two modalities and may suffer from the domain gap between natural image and medical image. The impact of this research is on the medical field to provide a more reliable and data efficient that can assist human experts in diagnosing chest disease. Main contribution of the paper. Firstly, the paper proposes BERTHop, which is a novel vision and language model for chest X-ray disease diagnosis. Secondly, BERTHop overcomes the domain gap between general and medical data by using pre-trained language and image encoder. Thirdly, BERTHop uses BlueBERT, a BERT variant trained on biomedical and clinical dataset as the language encoder. Fourthly, BERTHop uses BERTHop++, which is a feature extraction method based on successive subspace learning as the image encoder. Last contribution is that BERTHop outperforms state-of-the-art method. Okay, so let's have an overview of the proposed approach. Let's take the proposed approach is called BERTHop, which stands for BERT with BERTHop++. It is a vision and language model that takes chest X-ray images and clinical notes as input and predicts the presence or absence of 14 thoracic diseases as output. It leverages pre-trained language and image encoder to overcome the domain gap between the general and medical data and achieves state-of-the-art performance on the OpenEye dataset. The key components we have three key components. The first one is the language encoder. As we said, it's a Bluebird, which is pre-trained model that has been fine-tuned on biomedical and clinical dataset. Bluebird encodes the clinical notes into a sequence of language embeddings that capture the semantic and syntactic information of the text. The second key component is the image encoder, which is PixelHop++, which is a feature extraction method that applies successive subspace learning to extract ordered feature from images. PixelHop++ encodes the chest X-ray images into a sequence of image embeddings that capture the local and global pattern of the images. The third component is the fusion layer, which is VisualBERT, which is a pre-trained vision and language model that uses the language and image embeddings using self-attention and cross-attention mechanism. Briefly, the model structure consists of three main things, as we discussed before. Language encoder Bluebird, and the image encoder is PixelHop++, and last component is VisualBERT, which is the fusion layer. Okay, the training process. So the training process of the model are first, they resized all images on OpenEye to 206 by 206, and then apply unsupervised feature learner, PixelHop++. In this study, they used three-level PixelHop++ with hyperparameter W equal 1, W equal 3, and D equal 1, and S equal to 1. Then they applied PCA to its output channels and they generate vectors to form a set of Q visual features of dimensions D. The term PCA stands for the principal component analysis of the output channels and it's been used for dimension reduction. The D is the dropout rate, W is the depth. Then the second stage is OpenL dataset, for which professionals annotators label the data. OpenL comprises 3,996 reports and 8,121 associated images. In this study, they trained the transformer on the training set of OpenL with 2,912 images text pairs, unique patients collected by Indiana University from multiple institutes. Next, the model uses a cross-entropy loss function to optimize the binary classification of 14 thoracic diseases. The model uses the stochastic gradient descent optimizer with momentum equal to 0.9 and the learning rate equal to 5 times 10 to the power minus 5 with a batch size of 18. Next is the model is trained on 240 epochs, and the best model is selected based on the validation performance. Last step is the evaluation. This study has followed prior studies to evaluate models based on receiver operation characteristics, ROC, and area under curve score. Okay, we got to the result. The result of this experiment after evaluating the model on area under curve implementation and sklearn are shown in the figure bottom left, while the pie chart comparing the average area under curve with comparative models such as TNNT, TINET, and VB models. And from the table in the top right, it's seen that the BERTHop model outperformed TINET in 11 out of 14 thoracic disease diagnoses and achieved an average of area under curve of 98.23. and this percentage is 14.37 higher than VP model. In the practice, in the bottom, sorry, in the picture in the bottom right, they mark the pathology region annotated by two radiologists. As you can see, the yellow circle and lines. On the bottom, they visualize the visual features from BERTHop. You see the brighter colors mean higher feature values. As seen, BERTHop can successfully highlight the abnormal regions identified by expert radiologists. For conclusion, to conclude the study, first, the study has achieved a high performance data efficient vision and language models that called BERTHop for CXR disease diagnosis. Also, the BERTHop outperforms state-of-the-art models while being trained on smaller training set. Lastly, the visual feature extractor Pixel Hub++ and the transformer backbone initialization bluebird were shown to be effective in this study. The strength and weaknesses of this study. Before we go that, let's say what is the future research. First, it is recommended to explore incorporating anomaly detection techniques to further improve the model performance. Also, weakly supervised techniques or knowledge transformer may be used as large-scale annotated CXR dataset. And lastly, BERTHop may also be useful for other biomedical tasks such as COVID-19 disease diagnosis and radiology report generation. The weaknesses of this paper, first is dataset is biased. The author used MMX CXR for their experiment. However, this dataset is known to have some biases. Secondly, is interpretability. The paper does not provide much insight into how the BERTHop model is making its prediction. Last weakness is limited scope. While the multi-model approach of BERTHop has the potential for use in other medical imaging tasks, the paper only focuses on chest X-ray disease diagnosis. There are many, on the other hand, there are many strengths, but the main three strengths are an innovative approach, state-of-the-art performance, and completed evaluation, where the paper includes an extract evaluation of the proposed model, including comparisons to several baselines models and the ablation studies to evaluate the contribution of the different components of the model. So lastly, this paper, from my opinion, deserves a NIP score of 1. It's very good paper with a clear concept, which is, according to NIP scores, from the top 50%. This is all for this paper review, and thank you for listening.